So if you're a parent and your teenager has just been diagnosed with cancer, it is your job to protect them, to help them through every single aspect of their cancer journey. But what I would encourage you to do as a parent is remember that you have a teenager. You don't have a 5-year-old going through this, for example. And respect their individuality, respect their need for a little bit of space, a little bit of independence.
So I think one of the biggest challenges to Michael has been the loss of his mobility and the loss of his independence. With his surgery on his leg, and prior to that having a leg that was basically unusable for 6 months, it's been very hard on him. It's been hard on just getting around, but it's also been hard on the loss of his independence because he needed someone there with him practically 24 hours a day. So you try and give him as much space as you can. You try and support him as emotionally as you can. You try and get his friends coming around and visiting. You try to keep things as normal can be during that time, knowing full well that life will never be the same as it once was.
Sometimes teenagers are diagnosed with cancer and there is no cure, and that teenager may actually die from their cancer. Sometimes teenagers are diagnosed with cancer and they are cured and they can go on to lead normal lives. Sometimes teenagers are diagnosed with cancer, they're cured from their cancer, but they're left with some long-term side effects from the treatment that they received. We can't do anything about the fact that you got cancer. And we already know that there's certain recipes and protocols that we have to follow in terms of what chemotherapy or radiation or surgery you have to get. That's kind of set too. But what I would hope actually is that, and what I don't think we're doing a good job of right now, which I really hope to improve, is not making the whole process so scary.
Regardless of whether you have cancer or not, as a teenager, struggling with all the changes that happen in your body, going through adolescence, and sort of really getting a sense of what your body is like and what you look like, and comparing to everybody else. Body image is a huge issue for everybody who's a teenager. Sometimes we talk more about it, for instance, sometimes with young women, but it's an issue for everybody in terms of how do I look and how do I compare to my friends and my peers.
The body image, to a certain extent, some of it can be replaced and repaired, but other is, like his leg is changed forever. And even though he'll have a prosthesis, it's certainly not the full limb and the full mobility that he originally once had. So there's got to be some issues there for sure. Just may take a little longer to find out how deep they are.
I remember the night she lost her hair. It was awful. It was terrible. She went to her room and she locked herself away. And I think that was good because every child deserves a moment for themselves when they be diagnosed with this cancer, and you don't know what's going to happen, what's going to be the outcome.
Encourage open communication. Try and talk to your teens, even if you had difficulty talking to them before. This is a good time to start. Tell your teenager what your fears are and ask them what theirs are as well. You're probably actually thinking the same thing, so it will be helpful for everybody to just have those conversations.
And listen to her all the time, listen to what she's trying to tell us. Try to be there for her all the time. Yeah, if she asks us or if she feels very sick, listen to her and try to find solutions. Yeah.
I said if it wasn't for his positive attitude, we couldn't have been as strong as we were. We would have fallen apart long ago. But he was always upbeat, and he's the one who helped us get through it.
So I think children as adolescents should be responsible for their health care. They should be checking their breasts, checking whatever they have to do, so that they could be alert in the early stage and they could be able to share this with their parents, go to the doctor.
During all the treatment Michael went through, the chemo, the medications, and all that stuff, he kept track of everything. He memorized everything, and he used to remind us what dosage of pills he needed or when his next appointment was. So as far as moving forward and being on his own as far as going to doctor's appointments, etc., we're not worried about that. He has been managing his well-being through this whole journey.
She always has a very big smile on her face all the time. And I think that teaches you, like, you have to be strong enough to support her, right? If she had a positive attitude, why you don't have that attitude, right? Yeah.
5 years from now, I'll see her finishing school and, you know, looking forward to have a family and, you know, being in a good place.
I can see Michael as a college student somewhere, hopefully pursuing his dreams, maybe learning how to fly. Right now he'd like to be a pilot, so hopefully we're going to see a very successful young man that has matured early, but doing well for himself and achieving his goals.
Encourage your teenager to accept a little bit of responsibility for their own care, taking their medications on time, making sure they eat properly, making sure they do their homework. Don't let your discipline slide.